When we hear the word infertility, our minds automatically jump to women for some reason. But about 30% of infertility cases, and our next guest might argue more, are due to fertility problems in the guys. Okay, so here to tell us more about male infertility and to let us know about affordable infertility treatments is Dr. Peter Ahlering, the director of Missouri Center for Reproductive Medicine.
Well, thank you.
Nice to have you back,
Thank
sir.
you. No, I appreciate it. It's always good to be here.
Why is it that our minds typically go to the women? Because they're at fault how often?
It's just kind of old school thinking.
Yeah.
I would say it's solely a female factor, maybe 50% of the time. Solely a male factor, perhaps 40% of the time, 30%. Okay. And a combination of the two. It's a pretty significant percentage of the time. It's a combination of problems.
Gotcha.
Male and female.
And when it comes to the man side of that equation, we tend to think about two things: quantity and quality.
Most people think just about quantity. I say quantity meaning count, and motility is kind of a quantitative assessment. Mm-hmm. Qualitative assessments include morphology, which is shape and size of the sperm, and DNA fragmentation, which is more recent development in how we assess the genetic integrity of the sperm.
So as is the case with many, many things in life, quality supersedes quantity.
It is. If you had to rank them, DNA fragmentation would be number one, followed by morphology, motility, and then the least significant and relevant is the count. All of them are important, of course, but if you had to rank them 1 to 4 as far as influence on male reproduction, no doubt that DNA fragmentation is the most useful of all the tests.
So then the next logical question is there things in everyday life that we can do or avoid doing that improve the quality?
Well, I mean, it sounds like a broken record, honestly. To talk about things like no smoking, moderate intake of alcohol, moderate exercise, and follow a good diet, if you will. Those things, of course, are good for a lot more than just enhancing the male reproductive potential, but pretty much it cures all ills, if you will, and really is important to follow as a lifestyle. But popular out in the culture is antioxidants and vitamins and things sort of as supplements, to the point where it's really gotten kind of confusing because there's a laundry list of potential vitamins and antioxidants, all of them claiming to have the next best thing.
At the top of that list right there, too, we have this idea of abstinence.
Yes.
And I don't know if this is urban legend or what, but you hear that abstinence may actually improve the quality of the sperm you have. Can you bust that myth for us?
Yes, that again is an old school thought that abstinence is actually important, especially when you're checking a semen analysis. You hear these things, 2 days, 7 days, 2 weeks abstain. It's really it's not really relevant anymore. We recognize that, in fact, that the, quote, tank doesn't run dry, but also that it's probably the concept of out with the old, if you will, and in with the new. That probably is a relevant way to think about it.
People are concerned that the modern day treatment options are, pardon me, expensive, are very pricey, maybe out of reach. Not the case these days.
Yeah, well, it is true. I mean, the single most successful treatment that we have for the treatment of fertility problems in general and couples is in vitro fertilization. It is expensive, there's no question about it, but it is one of those things that it is the most efficient and effective way to have a successful pregnancy, and oftentimes, because of the fact that there's not a lot of necessarily repetitive treatments over a longer period of time, it ends up being more cost effective.
If you like, by the way, MCRM Fertility on Facebook and request a consultation through October, you're entered to win a free IVF treatment.
Yes.
That's a big deal. And to schedule your free consultation, go to MissouriFertilityExperts.com or call that number right there, 573-422-1886. MCRM Fertility is located in Columbia, Missouri, but a St. Louis location is in the works. We look forward to that. Thanks for stopping by.
Thank you. I appreciate it very much.